Mayor, how's everything there?
Well, we were doing well in the vaccination. We were doing 10 to 13,000 a day.
Mm-hmm.
And together with the national government through Secretary Galvez and Secretary Vince, we're getting the vaccines that we need. And one day a week, we open it to the people coming from the municipios, no? And from Guimaras.
Mm-hmm.
So that Iloilo City will do its share in helping out people from the other provinces. Unfortunately, this is what we're getting. The very slow genome sequencing as detected 11 more Delta cases in Iloilo, bringing it to a total of 15. The province yesterday got a total of 21 new Delta cases. The province of Aklan has a total of 26. Negros also had a total of several cases. That is what I have been saying before,
Yeah.
Chito, that the genome sequencing, which is based only in Manila, cannot serve the whole of the Philippines. Can you imagine taking care of Luzon, Visayas, and Mindanao? And that is the reason why we get results after 2 or 3 weeks. And they tell us that the Delta variant has already recovered. But we go back and do more extensive contact tracing and test everyone again. Two of the 11 cases came from DOH, the regional office, no? And they are requiring us to show to them an EO that they will be placed on quarantine after the Delta results will be out. Ay, very sad. And so we will have to come up with the EO, no? Because instead of getting cooperation from these people, they are making it difficult for us. And these are the people who are supposed to be helping us in this fight against COVID-19, most especially for the Delta.
Yeah, Mayor, what's the problem? What is this executive order all about, and what purpose does it serve?
They want us to show them an executive order that once they have been detected to have had the Delta variant, they will again be placed on quarantine and all their close contacts will be reswabbed. No?
Mm-hmm.
So we are preparing the executive order for their own purposes, no? Just the same.
So parang, okay, nanggaling sa DOH, Regional Hospital, yung finding na may Delta variant yung pasyente, and pag tinurn over or send back to the places of residences or residents, you in turn are required because of the executive order to put them in quarantine again and for retesting in the future. But isn't that the normal situation anyway?
Well, these two persons coming from the OH who were detected to have the Delta variant are requiring me to present to them an executive order. So we will do that.
Official sila or employee sila ng DOH?
Yep.
And nag-positive sila sa Delta?
Oo. Ngayon,
And
ayaw nila mag-quarantine, ayaw nila magpa-swab unless I can show to them an EO. Gusto nila may legal basis, Chito.
the sad part about your situation there is you have 15 Delta variant cases, and it is reported that you're going to have to tighten up border controls, etc. What are the plans this week for Iloilo City?
We have started tightening up border controls. Only persons with who are essentials for medical reasons, for the vaccines, etc., will be allowed to come in from the province. No? We are very worried because in the province they've been having 300 to almost 400 cases a day. For Iloilo City, we have seen the cases going up from 60 to 70 to 80 to 90, and then it was reported today that we have 102 cases already. The Delta variant is really here, and based on what happened in India and in the UK, it took four months before the cases started to go down.
Okay.
Unfortunately, all our hospitals in Iloilo City are the referral hospitals for all the provinces. 70% of our ICU beds and COVID beds are occupied by people coming from the provinces. What we are going to do right now is that we have made a request to DPWH for 3 modular hospitals. This single modular hospital will consist of 22 beds. We have also requested DOH for their assistance in terms of personnel, equipment, and medicines. For these 3 modular hospitals, it will take DPWH a month before they can construct these hospitals.
What would be the capacities of those three in total of those 3 modular hospitals?
66 beds.
66
Uh,
beds.
that can help us a lot because we are now going at 80% capacity for both the COVID beds and the ICU beds. Unfortunately, the province, which has a population of almost of a little over 2 million, has only 4 ICU beds. So all the severe cases are being sent here to Iloilo City. Together with the DOH, last night, Secretary Duque texted me that he will be endorsing it to Secretary Mark. We need these hospitals because this will take care exclusively of our Ilonggos.
Okay.
The Iloilo City patients are being backed out from our city hospitals because of the presence of the provincial patients. We are not complaining, everyone has the right to be taken care of. But we are trying to come up with a way as to how to manage the situation. And this is the only way that we have seen to get more COVID beds, to get ventilators so that if people will need ventilators, then they will have ventilators. I'm really open, Chito, to do everything. I'm on my way to my office to already discuss whatever needs to be done. We have 1,500 beds in our quarantine facilities. Just in case there is a spike of this Delta, And there are patients who need to go on quarantine. And we also have prepared oxygen tanks for them so that in case they only need oxygen tanks, then we will be able to provide them in the quarantine facilities.
Do you have
Uh,
sufficient supply for oxygen? Meron bang factory dyan?
so far, but the supplier needs to go to Cebu every day to get a very important ingredient that they need, no? And every day they go there by Roro, and then they get it back here. We bought some oxygen tanks, I think 60 or 80 of them for the quarantine facilities. As a matter of fact, I was surprised. I received a letter from the NBI inquiring why we are purchasing oxygen. Uh, well, we just have to answer it. No?